When I talk to employers about it, it really comes back to the various value propositions you can give your employee without giving them just pure health benefits. Things like, maybe a child loses a parent. Who's going to help that family navigate through getting survivor benefits? That's a difficult thing to do at a difficult time.
Mm-hmm.
It has no impact on the health plan. I mentioned food stamps. I mentioned FEMA. All of these are benefits that the employee is paying into, the employer is paying into, but yet many people don't know they exist, or it's so complicated they just give up and they don't know how to navigate the system. And if you stop for a minute and you think about some of the various organizations that are out there, we're going to cover Social Security disability, Social Security, Medicare, Medicaid, tribal benefits. That's a lot. Railroad pension benefits. There are just many different nuances, veterans benefits. So the average American, if they had 2 or 3 of those that touch their life, they're going to have to go to multiple buildings, multiple facilities, get on the websites, and just navigating that complexity is very difficult.
Mm-hmm.
Whereas if they had a Sherpa, right, someone like FEDlogic to kind of hold their hand and navigate them through it, makes life a whole lot easier.
Hi, and welcome to the Captivating Health Insights podcast. Today we're talking about maximizing federal and state benefits for employees and their families. And I'm excited to invite our guest on to the podcast today, Max Osbun from FEDlogic. Welcome, Max.
Good morning. Thank you for having me.
Of course. Well, Max, just to kick things off, for season 2, I'm asking this question. If we really knew you, Max, what would we know?
That's a great question. I think if you really knew me, you would understand how passionate I am about what we do. And it's really helping families. At the heart of every day, we impact families' lives that are typically going through a difficult time. They don't understand what they don't know.
Mm-hmm.
And when they do, it can be a game changer when you help somebody navigate away from filing financial bankruptcy because of medical debt. That's the leading cause of bankruptcy in the U.S. today is medical debt. So helping families understand that there are different options and alternatives, it's a passion, but it's truly just about helping people.
Yeah, that's amazing. It's not a lot of people, not everyone gets to do truly meaningful work. So that's amazing that you get to feel really proud of what you do and how much it's helping people. So
our entire organization is that way.
That's awesome. Well, thanks for sharing. Thanks for answering my question. I appreciate it.
You're welcome.
Well, Max, would you mind giving us a quick intro of how you got into this industry and your role, and just get us up to speed on who you are?
So I've been in this space a couple of decades. Really started out working with self-insured employers quite some time ago. And it really kind of came natural because my brother was born with disability. And so when this opportunity came for me to come into FEDlogic, it was just a natural fit.
Awesome. And what would you, kind of in a nutshell, does FEDlogic offer employers for those that may not be familiar with FEDlogic yet?
So what we do is we help guide families through the complexities of dealing with federal and state government. When they have special needs, there are a lot of governmental programs in the marketplace that, quite frankly, families just don't know about, or they don't know how to access them. So really what we're here to do is help guide them through the bureaucracy, the red tape, and really cut through for them and hold their hand and show them what is possible.
So we're talking about federal and state benefits that most employees probably aren't even aware of that they have, right? I mean, we look at our paycheck, and every month we got money coming out, right? And it's going to these resources. So help me understand why most employees aren't really aware and aren't able to really navigate this on their own.
Unfortunately, the U.S. healthcare system has just become so complicated and so tied up and tangled up. You're right. We all pay in 2 federal insurance programs, specifically Medicare and Social Security. Those are federal insurance programs that we all pay into every 2 weeks or month, however we get paid. But most people don't know what those programs can do for them, or they don't know how to access them because of the complexities. I mean, on average, the average American has a 7th, 8th grade high school reading literacy level. And navigating at a very difficult time in your life when you're going through, some catastrophic type event can even be more challenging. So what we are here to do is to really, again, hold the family's hand and help explain what is the pathway.
And help me understand, what was the origin story of FEDlogic? What problem did the founders see, and how did it all start with bringing this service to fruition?
Yeah, so one of our co-founders, Frank, he and his family immigrated to the U.S. and English not their first language. His sister, Alex, was born with a severe mental disability. Alex will never work. And Frank grew up really being an interpreter for his family as well. His dad had great insurance. Frank went on to go to college, came back to the greater Nashville area where they were living at the time, and got his kind of first big boy job at Social Security. And he worked there for over a decade, and he learned the system from the inside out. But he also learned how broken, complicated, dysfunctional, confusing that the system is. And he realized when he was working there, his own family missed out on a lot of benefits that they would have been entitled to. Mm-hmm. So, he would come home and complain to his wife, Elizabeth, or EJ as we call her. And, she finally said, dude, it's time to do something about it. Let's take action. So he ended up leaving his job, and together they started this company, FEDlogic, to really help families navigate through the complexities because they saw what their own family went through.
Wow. And you said you have a brother. So did you all, growing up, did you know about some of these benefits that were available as well, or a similar story?
Some, not all, very few. So my brother was born blind and partially deaf, and he's been dual eligible his entire life. And, seeing, when dad had, one of the big insurance companies, they don't pay for all of the needs. They don't pay for transportation to and from the school for the blind, which was a 3.5-hour car ride one way. They didn't pay for home modifications, for the hearing devices, learning how to read Braille. Those are all things a family like mine needed, my brother needed. So, having Medicaid step in was a godsend at the time. When you've got 7 kids and one with high special needs, wow, that's a big added cost.
Mm-hmm. Wow. And so I want to help people understand, because I had no idea that there are so many services for so many different conditions. And so help me understand the number that we're talking about here.
So it's really about being, it's not necessarily the condition that you have. It can be. There are certain federal carve-outs, ALS, ESRD. Those are federally carved out and kind of named by name. But it's really about the level of disability.
Okay.
And so you could have many different medical conditions, but it's, are you able to work? Are you able to do the ADLs? Are you able to take care of yourself? So it's that. But I think where I hear you going is there are some that are expedited, because what we know is that somebody who goes it alone, tries to get a federal disability, that can take up to 2 years and beyond to get qualified. It's a very complicated, unfortunately, cumbersome process. Mm-hmm. So there is a list of 300 major medical conditions on what's called the Compassionate Allowance List. That list is an expedited pathway that the federal government has acknowledged. If you have one of these major conditions, you can get your application for disability expedited. And that can be significant for families.
Mm-hmm. And aren't there around, isn't it like 1,100 state programs that an employee may qualify for, but they have no idea? Can you give us like an example of some of the common ones that you see?
Yeah, common would be certainly Medicaid or CHIP for children. Those are extremely common. Mm-hmm. But from our vantage point, from FEDlogic's vantage point, we do cover over 1,100 specific state benefits. I mean, we're able to help families and not always prove an ROI back to the employer. It's not what it's about. It's about helping families. That's our mission. Our mission is to help as many families as we possibly can. So we're going to help families do things like get food stamps. If they fall on hard times and they're having difficulty putting food on the table, that's a state level benefit. Even as far as from a federal perspective, helping families navigate through FEMA claim forms. So one example that just happened a little over a year ago was when the hurricane went through Asheville, North Carolina. We have quite a few employer groups in that region. So we put 2 dedicated people on just helping families navigate FEMA claim forms, which has no impact on the health plan, but a huge value add back to those employees.
It almost makes me think about social determinants of health. And I know, if you've been in the health insurance industry, hospitals, wellness, well-being, for the last, few years, 5 years, we've talked about, how do we not only help employees in their job, but how do we address these social determinants that are impacting their health and their health care? And I mean, from what you're saying, and this aligns with that. If you're helping, at a family in a time of financial need, that's a social determinant of health, and you're helping that family be healthy and get the food that they need to survive that time. So I think that's an awesome resource.
I mean, we've even gone so far as to help them from a financial aspect when they're hit with a medical crisis. Looking at are there federal or state opportunities out there that could stave off the creditors for, say, a mortgage. So we're going to help them find all of those types of resources. So it truly is going down the path of the social determinants of health.
That is so helpful. And you mentioned ROI, and I also, I think people have heard the term VOI too. So what's your return on investing in a program like FEDlogic? What's the VOI? How do you kind of help employers understand what that would mean for their business and their employees from both of those angles?
That's an interesting question. When I talk to employers about it, it really comes back to the various value propositions you can give your employee without giving them just pure health benefits. Things like, maybe a child loses a parent. Who's going to help that family navigate through getting survivor benefits? And that's a difficult thing to do at a difficult time. It has no impact on the health plan. I mentioned food stamps. I mentioned FEMA. I mean, all of these are benefits that the employee is paying into, the employer is paying into, but yet many people don't know they exist, or it's so complicated they just give up and they don't know how to navigate the system. And if you stop for a minute and you think about some of the various organizations that are out there, we're going to cover Social Security disability, Social Security, Medicare, Medicaid, tribal benefits. I mean, that's a lot. Railroad pension benefits. I mean, there are just many different nuances, veterans benefits. So the average American, if they had 2 or 3 of those that touch their life, they're going to have to go to multiple buildings, multiple facilities, get on the websites, and just navigating that complexity is very difficult. Whereas if they had a Sherpa, right, someone like FEDlogic to kind of hold their hand and navigate them through it, makes life a whole lot easier.
Yeah, that makes sense. That you need a guide to navigate all. We all know how complicated healthcare is. Government programs are, even for an HR person. Even when maybe that's a part of their job or they're trying to help these employees, it's even a lot for an HR person to understand. And so it makes total sense that outsourcing this as a resource, it's too much for the average person and the average HR person as well.
It's well beyond, the HR, and we think HR has all the answers when it comes to this. But I mean, understanding federal policies, federal regulations, and then just how to navigate within those is very complex. But back to your question about the VOI component, I think there are a lot of organizations, employers out there that have part-time workers where maybe they don't have full health benefits.
Yeah.
But they depend on those workers. Maybe it's the retail industry, maybe it's the food industry, the hospitality industry, the farming industry. There are a lot of industries that, really depend on part-time or seasonal type workers. And we cover all of those in our pricing structure. We don't charge for those. Those are actually free. Our pricing model is based on benefit eligible employees, but yet we cover all of those other entities as well.
That's awesome.
To really wrap around that employer, because it's really about the employer and how they can bring that value back to their employee base, whether they're full-time, part-time, or seasonal.
That's amazing. So it's offered to a wide variety of the employee population. And obviously you're seeing that value from a humanistic standpoint or an employee value standpoint. When you're talking dollars and cents though, what's kind of the average you see return for the employer in the first year or the first few years?
Just about curious. A 7-to-1 return on investment.
Wow. Really? Yeah. So what is that usually? Is it like cost avoidance, or how are you kind of calculating that return?
We're not even looking at the VOI component. This is
that's
strictly
just
based
ROI.
on cost. And I would say that's a ultra conservative number because we don't get claims data. So we're not looking at individual claims data. So if somebody decided to leave the health plan because they had a conversation with us, we don't take their actual cost and say that's part of the ROI. We take a flat rate. Everyone is evaluated the same. So that rate's $26,400. Mm-hmm. So whether that was a premature baby that would have cost them $10 million, or whether it was a person 65 and older who was otherwise healthy, we put one flat number on that transition off the health plan, 26.4.
Okay.
And so based on that 26.4 number, we're looking at a 7-to-1 ROI. So if you really dug into the claims and calculated it, it's probably 3 to 5x higher than that.
Okay. And that's good to know that it's like the hard dollars, not just the value that you're also bringing to families. Since we talked a little bit about the compliance aspect, what would you say, like how does FEDlogic handle any kind of compliance concerns? I've heard a couple of things about this that, obviously you don't want to persuade anyone off the health plan. There are, rules about that. So how does FEDlogic handle that from a compliance standpoint?
I would say first and foremost, we're a very compliance forward company. We lean into compliance for not only our safety, but our clients and the employees as well. Mm-hmm. So compliance isn't one thing, it's a whole bunch of little things. First and foremost, we don't endorse companies, we don't endorse products, we don't sell anything. And because of that, I don't get paid a bonus, a spiff, or a commission on the backside for making any kind of a referral. Mm-hmm. So if you had a person 65 and older who wanted to retire and needed a supplement plan, we don't sell insurance. We're not here to sell the employees anything. We're here to hold their hand and guide them through the complex processes. That's it. Mm-hmm. We don't have quotas in our company. So our people who are answering the phone, we call it our expert team. These are the people that have a lot of experience. And in order to get a job on our expert team, and the expert team are the people who are talking to the employees, you had to have spent at least 10 years in one of the major agencies.
Wow, 10 years.
10 years. The average tenure in our company for that team is over 20 years of experience.
Wow.
So talking about navigating the bureaucracy, they've worked in those agencies for a long time. They know how they're wired. Mm-hmm. So they know the policies and they know the procedures. We're able to guide them through, but we don't get hung up on, okay, you have to take 14 phone calls before lunch and you have to make one transition off the health plan. We don't have any of those kinds of quotas. If our folks spend a half a day talking to one family, that's a good day.
That's awesome. That's a lot of experience that you're experts. So the experts are the front line. They're the people talking to the employees. So let's continue with that. Help me understand kind of A to Z. What does that look like when you're engaged, when your experts are engaging with employees, and how you help them?
So I'll back up a half a step there. How we charge is based on full-time eligible, benefit eligible employees, but we cover full-time, part-time, seasonal dependents, anybody in the household, and we do it for 2 years post-employment. Okay. So with that, it's a big, broad net by design, because we know healthcare decisions are not made in a vacuum. So handling, maybe you've got a part-time employee whose elderly grandmother lives with them. Grandma can take advantage of our benefits.
That's amazing. Just because they're in the household?
Because they're in the household. And because we extend to part-time people, so the part-timer and anybody in their household would be covered. So we know that those instances where they're having difficulty with grandma and she needs to find a different healthcare option, that's going to come back to the employer, because that employee is going to be distracted. whether it's a full-time or part-time employee.
Mm-hmm.
So again, that's part of that VOI equation as well. But I think looking at the family holistically, looking at that household holistically, so that engagement process is going to really start with, I'm going to say a series of questions, but it's a conversation.
Okay.
And we want to understand what's going on in that household. Who's in your household? Who's using benefits? Who needs benefits? What type? What is their history? Have they worked at the railroad? Are they a railroad pension? Are they tribal benefits, veterans benefits? So you have to uncover all of this because you could have a dependent who maybe is really truly disabled. The spouse is still working to provide benefits because maybe they tried 3 years ago and they failed. They didn't know they could appeal it.
Oh,
so
okay.
that can have an impact on the primary subscriber, meaning, I'm 67, I can't retire because I'm taking care of my son's 3 kids because my son doesn't have the ability to take care of his kids. Well, okay, hold on. Let's unpack that. Okay. So you got to find out what's going on in that household.
Gotcha. So that first conversation is really kind of like, okay, let's understand what's going on, intake, all the information.
Big discovery. Yep.
Yeah. Discovery call to understand what they might be eligible for that they had no idea.
You could have something else in that household going on that's impacting that subscriber, and that subscriber's keeping that job just for benefits.
Mm-hmm. So
speaking
of, you already gave a couple examples like retirement and Medicare. So what are kind of those common life events that are uncovered? I know that there's lots of different examples of any kind of common ones that
you've heard one call, you've heard one call, right? I
Yeah.
mean, it really can go all over the place. I mean, with 1,100 different specific state benefits and then the whole list of federal benefits on top of it, I would say from a call frequency, certainly 65 and older, just how do I retire? It's a complicated process.
Yeah.
I know what I know. I'm comfortable with my group plan. I've been here for 15 years. Why do I want to leave it?
It's what I know.
It's what I know, and I'm comfortable with it. What I don't know and I'm scared of is the fear of the unknown. How do I make that transition? What if I fill in the blank, right?
Mm-hmm.
And so it's a very scary proposition for people to they feel like they're jumping off a cliff, right? And they don't know what they don't know. And the other problem is people will have 2 or 3 questions about me and my retirement. They ask somebody, a neighbor, a friend, somebody at church, somebody at work, 3 questions and they get 15 different answers.
Yep.
And so now they're even more confused. So what a great resource to come back, call FEDlogic and untangle it. To the employee, it's unlimited, confidential and free. So that employee can call as many times as they want to untangle whatever it is they're thinking about in terms of what is keeping me from moving to the next step. Because at some point in time, we all want to retire. I don't want to work until I'm 99.
Mm-hmm.
I'm sure you don't either.
No, I don't.
And so it's like, how do I get there when the time comes?
I want to go back to, you had mentioned compliance, and I've heard a couple of times just there can be compliance concerns with these types of programs. I'm not sure if that's true or not. Can you just speak to that and how you would answer that question?
Yeah, I would say, yes, compliance is and should be a concern for whether you're the consultant or the employer, and certainly it's in the forefront of our minds. We are a very compliance-forward organization. I would say we lean into compliance.
Mm-hmm.
So we've been vetted by every major national brokerage firm in the United States from a compliance aspect. Compliance, as you know, isn't just one thing. It's a bunch of little things. It's how you do business. So it's woven throughout the fabric of what we do every day. And I think it speaks volumes when we can lean into and say we've been vetted by multiple legal organizations from these large brokerage houses that all have passed us with flying colors.
Wonderful, wonderful. I want to make sure we cover that. So, because that's just, I think it's common in this space. There's lots of different, compliance concerns with any sort of employer-sponsored health plan. So I think that's great.
It's a litigious world that we live in. So
it is.
Absolutely. And the employers should be concerned with that.
Yeah, that makes sense. And I wanted to dig into a little bit more about what we were talking about before. Are there any commonly misunderstood situations that you all see, and can describe how you handle those?
Yeah, it's a great question. I think there's kind of 2 that pop into my mind that is kind of a aha moment for a lot of people when we have conversations. And I say people, consultants, brokers, employers, those are, one, premature babies and how they can be covered. Most people are shocked when I say Medicaid will pay the bill on a premature baby, regardless of how much money mom and dad make.
Really? I didn't know that either.
Yeah, that one. And then end-stage renal disease, people undergoing dialysis, for kidney failure. That's a big aha moment for a lot of people as well. Most people have heard about the 30-month coordination period for ESRD members. An ESRD member, employee, is going to cost anywhere from about $400,000 to $650,000 a year. It's a very expensive condition.
It's end-stage renal disease, right?
End-stage renal disease. Yep, that's the condition. And then the physician prescribes dialysis, and it's basically filtering for their kidneys because their kidneys are in failure. So they're waiting on a kidney transplant. So that financial amount, $400,000 to $650,000, is before the kidney transplant. Very expensive,
wow,
especially for a self-insured employer. Granted, you're going to hit spec, but the stop loss is going to come back and hit you next year because you hit spec, right?
Right.
So the common misconception is this: most people have heard about the 30-month coordination period. It is not a waiting period. You don't have to wait 30 months to move to Medicare as primary. At the end of month 1, after completing dialysis at home, or the end of month 3, after completing dialysis in a clinic, the employee has the ability to voluntarily withdraw from the group health plan, causing Medicare to become primary. That would relieve the financial burden from the employer, but it also helps the member immensely. So truly a win-win. So from the member's perspective, many times what we hear are things like, I am so sick the day after dialysis, I can barely get out of bed. If I didn't have to work, I wouldn't. But I can't get on the government plan for 30 months. I have a 30-month coordination period. Most people don't even know what that means. Well, good news, Johnny, you don't have to wait 30 months. So this is where the education comes in, and you can explain to them. So these people many times are having to Uber to work or have a family member drive them to work. They truly feel like their back is against the wall, and they're in a really bad situation and a no-win situation. So when we're able to explain what the policies are and what the process is, about 60% of the time, they voluntarily withdraw from the group health plan and go directly to Medicare because they can. That's the rule. It's perfectly legal and acceptable to do that. And what a relief for those individuals to be able to focus on their health and not have to worry about the fear of, if I lose my job, I have to file financial bankruptcy. What am I going to do? I can't afford $500,000 a year to pay for my own dialysis. I mean, it's really, truly a win-win. And many times these individuals end up saving anywhere from $10,000 to $12,000 a year in out-of-pocket medical expenses. So it's a financial win many times for them, but it's an emotional, clinical win for them as well, being able to migrate off that health plan.
So the common misconception is most people think you have to wait 30 months, but that's not it. It's
not
you
true.
have up to 30 months. And I think I've heard this described as like one thing that the government actually did really well is that they put this rule in place. Is that true?
It is, because if we go back and look at the inception of why Congress passed a law a few decades ago to cover end-stage renal disease, that was a great move on the behalf of Congress. But they realized that it's really complicated to move from a group health plan to a government-sponsored Medicare type plan. I mean, look at your 65 plus population today. Why do they not go?
It's complicated.
It's complicated.
Yeah.
They're scared of it, right?
Exactly. Yep.
So they don't do it. They do nothing. Same thing here. But Congress knew that they were fearful that carriers and self-insured employers could move to push them off the plane a little early. So in the event that might happen, Congress put a safety net in place and said, you've got 30 months to get your paperwork in order to get yourself from A to B, from a group health plan to Medicare. So with that, it protects the employee, but at the same time, it's not mandated that they have to wait.
Gotcha.
When you're ready to go, you can go. When you have your proverbial, paperwork in a row from the federal government. But there is part of that is a qualification period, and that is 1 month of dialysis at home or 3 months of dialysis in a clinic. and your paperwork all in order, then you're eligible. I shouldn't say eligible, then you're ready to go. But it's at the discretion of the employee, 100%.
Well, it's such a good example of just how someone can come alongside you and help inform you of these laws and the process of how to make sure you are ready and your options. And it just is a perfect example of, how they can help people.
And it really needs to be the employee's decision because it depends on your level of treatment. One person may be getting dialysis for an hour a day, 1 day a week. The next person may get it for 3.5 hours a day, 4 days a week. And so the treatment is very different. The impact on your body is very different. So one employee may be able to tolerate treatment A. The second employee may not be able to tolerate treatment B. So it gives the employees an option of what's best for them and their family.
Right.
But knowing your options are a good thing.
Yeah.
I mean, these are, again, benefits that these employees have paid for out of their paycheck every 2 weeks.
Right. We just forget about them because when we don't need them, we don't think about them.
You don't understand them. You
Right.
don't understand the rules and the process and the policy. It's complicated. It's bureaucracy. It's red tape.
Yep.
And that's why you need a Sherpa to help you navigate through that complexity.
Yep. Yeah, it makes total sense. And then what about, I'm thinking about Medicare and the marketplace. How do those things kind of like fit within this picture with these programs?
Yeah, it's a great question. Don't let me forget. I want to come back and talk
Okay.
about premature babies as well.
Okay.
Because
Okay.
those are the two examples.
Yeah.
So Medicare and the marketplace, I mean, they all have to gel together. Let's say that. So for us in our business, we're going to use the marketplace, let's say in lieu of COBRA. There's two pathways, if you will, to COBRA. One could be involuntary termination and one could be medical. So let's take the involuntary termination, for example. Just understanding, out of the gate, who typically takes COBRA? It's somebody who needs COBRA, right? That healthy 25-year-old typically will say, I'm good. I'll wait till I get my new job. It's right around the corner, right? It's the person who says, I have a child going through chemotherapy or my spouse going through, dialysis, or there's a big event going on. So those people are the ones typically who are going to elect COBRA. Now, how the open marketplace comes into play is we're going to sit down with that family and go through, again, the whole household, who's doing what, who needs what, how can we help the household, and then understanding, let's call it the old Ben Franklin, the T chart, however you want to refer to it, and looking at, okay, over on this side, if you pay for COBRA, this is what you get and this is the cost. And you and I both know the cost of COBRA to the employee is pretty high because it's non-subsidized.
Right.
But there's also a cost to the employer because they still hold the risk on the backside. It's not just about the premium, it's about the premium and the risk. So the employer has a lot of skin in that game as well, because if there are high cost claims, it's still going to hit the employer. Now, what we're going to do is sit down with that family and explain to them that, okay, now that your income went to zero, you may qualify for federal subsidies. If you've looked at the open market before, that's not your price today because your household dynamics changed. So now let's look at what you can get in the open market. Again, we don't sell anything, so I'm not trying to sell them a plan, right? So we can look at the open market and the employee makes a determination what's best for them. And many times what they find is, in fact, about 97% of the time, by our statistics, when we have that conversation, they do not elect COBRA. And if they're on it, they drop it because the open marketplace is a better plan for them.
But again, they're showing them their options and then letting them make the decision.
Completely the employee's choice.
Yep.
Just helping them understand what are their choices.
And how, if I'm an employer and I'm thinking of, putting this service in to be the Sherpa, to use your term, for my employees, how do you help employers engage their employees and educate them, communicate that this is a service that you may have no idea that you're eligible for?
That is where the rubber meets the road.
Yeah, for all these programs,
For
right?
all these programs, you can have the best thing ever, but if nobody knows about it or don't understand it, what good is it?
Yep.
So my term, and our head of marketing is probably going to slap me here, but I call it the 3 pillars. So we have really 3 pillars to engagement. And number 1, it's a plug and play marketing campaign. We have heard loud and clear from the HR and benefit teams that they don't want point solutions talking directly to their people. They want to control the volume, the cadence, the message. So we've created a toolkit. Inside that toolkit, there are tons of literature, banners, flyers, posters, postcards, digital birthday cards, closed circuit TV slides. I mean,
I like the birthday cards because then you're like, it's triggered. Yeah. Mm-hmm.
So for getting ready for retirement,
right.
Say you're 60 plus.
Right.
Yeah. So all those tools are in this toolkit and they're all co-branded. So let's just say somebody from the benefit team or the HR team went to the toolkit and they pulled on a Cobra flyer. It's going to have their logo built right in it. So it's literally plug and play. They just need to talk to their employees, however it is they talk to their employees. And, you know, some employers, I mean, if you're a heavy metal foundry, I'll tell you the best common practice for the ones that I know of that we service, they're going to print a poster. It's 8.5 by 11, one in English, one in Spanish, and they're going to hang it above the urinal in the men's restroom.
Yeah.
That's how they talk to their people, right?
I've seen it many times.
Yep.
Yes.
But if you're a large bank with a couple hundred branch locations, and you know that's one of our clients, they don't want stuff hanging in the banks.
Yeah.
They want it all digital. So they want to be able to email out a PDF. They want a QR code that they can put on a closed circuit TV slide. It's all in that toolkit. So we do ask for a partnership from the benefit HR team that we need a couple hours a year, 2 to 5 hours a year of your time, because I can't come to every facility and hang posters for you. That's something they need to do. So that's the plug and play marketing campaign. The employees also get a private labeled website. And so the employee, when they log in, it's a resource center to all of those 1,100 plus type programs or the high level of those, right? It's a benefit resource center from a state and level, federal and state perspective. So we know, you know, many times foot traffic to those sites are kind of low. I would say we're probably a little higher than the average just because of what we're dealing with. So, you know, if you're a family going through something major at home, you're looking for resources.
Right.
So we probably get a little higher foot traffic than most. But I would say that is the foundation of the how do we communicate. Number 2 is old school HR referral, right? HR can have a conversation. It works really well. We do not cold call people. We do not, you know, blindly reach out to people. We will proactively call. And part of that is if HR makes that referral. So if you're having a conversation with HR and HR starts talking to you about FEDlogic, and HR could say, would you like for me to have them call you? And we will certainly then reach out to that employee, but we've been invited for that call.
Yep.
And the third way is we want to integrate with all of their processes. So there's a whole host of areas that we can integrate into their current business process because we do not want the success of FEDlogic to ride on the back of the HR team. We want to embed in these processes. So, for example, birth of a child. Let's talk about premature babies, right?
Yeah, we're going back.
So we're going to go back to that one. So birth of a child, most employers, the process is this. The family member logs into a portal. They choose life event, birth of a child. They answer a couple questions, and they take all those babies that get added, right? That's kind of the standard process.
Yep.
I would say put a pause on that. One of the family members logs into the portal. They choose life event. They choose birth of a child. A pop-up window should occur that asks a couple of rhetorical questions. Is your baby still in the hospital? Was your baby born with a special medical condition? Does your baby have special medical conditions? So we ask a couple of rhetorical questions, and then you put a statement in there, something like, FEDlogic, we have a partner called FEDlogic who may be able to help you reduce your family's out-of-pocket medical expenses. In addition to that, they may be able to provide resources that we don't or can't provide you here from work. And then you put our contact information, certainly a HIPAA disclaimer and so forth, goes into that pop-up window. But that gives the employer a fighting chance to intervene in that process prior to just taking all comers to the plan.
Right.
So you're getting in there at that point or that time of need for that family, because we're not going to talk to probably 95% of the employer's population. We're going to talk to probably 5% on average. We have little to offer a healthy 35-year-old. They're healthy. They don't qualify for disability. They're 35. They're too young to retire. Now, certainly a premature baby or some of the value add components like helping with food stamps or FEMA claims or things like that, yes, we can help with those. So we have a lot to offer everybody, but when you're talking about that critical need population, it's probably about 5% of the population.
Well, and we all know that small percentage of your population is driving the majority of your cost. And so, yeah, we as in the industry understand,
Yes.
right, how those numbers work.
Yes.
So help me understand if you're talking to the average HR person in general, based on kind of everything we've talked about, what advice would you give them as far as kind of maximizing their benefits and thinking about a service like this for their employees?
We have worked really hard to set this service up to truly be a no-brainer. I mean, this is the proverbial easy button. And I think the advice is be open to other alternative options and get creative. And a solution like FEDlogic is truly a safety net. If you want to go back to the social determinants of health for the employee, it's a big safety net for them, but it's also a safety net from a risk perspective for the employer. And being able to increase and enhance your benefit offering, saving $100,000 or $1 million out of most people's budget is a big deal. And being able to not increase premiums for the rest of the population because it was driven by 2, 6, 10 people, right? And we see that all the time where the entire population is taking that proverbial hit in terms of price increase because of the rising healthcare cost in the claims bucket. So if we can help mitigate or navigate them through that, I mean, 89% of the $1 million claims are driven by people under the age of 60. 89% of the $1 million+ claims under the age of 60.
Really?
So having just a strategy of how do we help our 65 plus people migrate off the plan? How do we get them comfortable? It's a great strategy, but you're missing almost 90% of those super, super high cost claims.
Yeah, interesting. I would think most people would think that that's where, the over 65 is where, the majority is. But you're saying, no, a lot of times it's actually under 60. And so there's risk there.
The average cost of a premature baby on paid claims is $3.3 million. So it just takes one of those,
right.
And,
to kind of blow it up.
And to see a $10 million premature baby is not that uncommon today. I mean, a helicopter ride and a couple of organ transplants and, 4 or 5 months in the hospital, you're at 10 million pretty quickly.
Well, and I love your idea about embedding it into their processes, because if you are one of those parents with a premature baby, like, you have so many things on your mind, and, getting them added to the insurance and, looking into resources is probably the last thing you're thinking about. So how can we make it as easy as possible? Like you said, with a pop-up or whatever it looks like. That's
totally. And we don't want HR to have to be the linchpin in making this thing work. We want to make sure that we're there to where the employee needs us to be and when they need us. We're like that elephant gun. You don't need it till you need it, right? And when they need it, they really need it.
Yeah, badly.
Exactly. And when all that is kind of hitting the fan, it's great to have us embedded in that process so that HR doesn't have to think about it. And the employee, it is there. Another great example of being embedded in the process is we have a tool. It's an online digital survey for the employees. It takes 3 to 5 minutes. And it's going to ask them some very basic questions. Things like, have you or somebody in your household ever been denied a federal or state disability application? Again, they could have filled out an application 3 years ago, got denied, didn't know they could appeal it, right? And they're just, now the employer is sitting on this high cost claimant. So what about putting that survey in the open enrollment?
Yeah,
right?
or any other survey.
Or
that makes sense.
A new hire checklist.
Right.
Somebody coming in the front door for the very first time. Put that checklist as part of that process. That's what I'm talking about, is embedding into the current process so that HR doesn't have to think about this every single time.
Yeah, it makes perfect sense.
Because most of the stuff HR really doesn't want to know and probably shouldn't know about, to be honest with you.
Right, but it greatly impacts them. Exactly.
So that survey is really, really impactful. We've seen a tremendous uptick in the use of the survey, perfectly fine to incentivize employees to take that survey. We see that often, and it's very meaningful, very impactful.
Well, this has all been super helpful today. Thank you so much, Max. As we kind of wrap up here, anything you want to leave our listeners with in conclusion?
I think just being open-minded to, new ideas. And this is not a new idea. We've been here. We just started our 11th year in business. I mean, certainly not a new idea. We serve over 10 million people around the country. but yet many of the employers aren't familiar with what we do. And when they hear federal and state benefits, I think it takes a second to sink in, and you have to really kind of understand it, because one of the probably common reactions is, oh, I don't need that. I have insurance.
Right.
And it's like, whoa, hold on. Yeah, you're paying for this stuff anyway, right? And that's what we talked about in the beginning.
Yep.
So I think getting people to open up their mind to what this can mean to the employees, to their families, and certainly to the bottom line of the organization is big.
Yes. Well, I hope that people do, because like you said, we're all paying for it anyways, and they're great resources, and we just, want to help people use them. So thanks so much for being here today and being on the podcast, Max.
Thanks for the invite. I enjoyed it.
Me too. Thanks.